Well, greetings again. This is Dr. Bill Wyatt for the American Orthodontic Society, and I have a video today that I want to show you about advancing the mandible. In a lot of cases where we had TMJ problems, we advanced the mandible to get the condyle off of this retrodiscal tissue, and it makes the patient look so much better in many cases. So we have done some of the cases simply for aesthetic reasons, to advance their mandible to make them look so much better. So you can be a judge of this. We're going to show 4 cases here where we've done that. We have an extended video on each one of them if you want to go back and follow it all through. We're just going to show the start and the finish in here, and that'll help you kind of understand why you could advance somebody's mandible and get them to hold it there and keep it there. If they stayed there over a period of time, you can't get the mandible back. The condyle will go, it'll lean back and let the jaw go forward, and there's a gonial angle right in here in the jaw. Will get larger and the jaw comes out. You don't make the jaw grow any bigger, but you change the angle down here and also the angle of the condyle coming off. It'll lean back like that. That lets the jaw go forward, and the angle gets bigger and the jaw comes forward that way. So let's get on to these cases. I'm going to run through them as fast as I can here, and hope you can understand it. You have to go to back to the full video of each case. You can do that also. So I'm going to advance here to the first one. I'll touch this and get going. Here is a lady that worked for me came to work for a while, and this is the way she looked before we advanced her mandible. And that's this is the most drastic change of any of them, that we are going to move this jaw forward like this and come out here and watch the way it changes the appearance of the person. Now, she had a TMJ problem, and this stopped the TMJ problem by getting the condyle out in front so it's not pressing on this retrodiscal tissue. And so here are some of the pictures of her case. You can look the whole thing up if you want to. Now, this is after we finished the case up pretty much, and started out, her overjet was looked like about 12. Like, we'll bring this to where this cuspid right here is coming down in this point. In other words, we'll move the jaw up here and kind of round the top out too, right here, and we've got these almost where we want to. A little bit, needs a little bit further out, but this is now sometime after we started. This was 1984, this is 1988, right here. Now here again, this is 84, and another, I think this is 90 something, I don't know. But this is the way the side looked over here, and we've advanced. This went up some, and this came back some, and we have the two together coming right down in that spot, right like that. Now let's get on the upper. Then we've widened this out. You can see that in there. And if you want to go back to the full picture, you can do that. That's 1990, that's 1984. That's a long time in there. She wore a night retainer with a big ramp that made her put her jaw out here. This, I don't like these, but we use a 3-to-3 retainer down here that you take on and off. I don't like those. In the daytime, we wore one with a small ramp, but you could get behind, but they're conscious, and they thinking about how they look, and people keep their jaw out front during the daytime. So you have a double retainer problem in some of these cases. Now here is much later down the line. This is '03 right here, and this was 1980 something back here. This is, she's grown older, but the jaw is out there, you see. Now, from the side, and there she was, 1985, and this is '03, so that's 85, 95. Now it's not quite 20 years yet, but it's the facial structure. She's lived her life with it like that rather than this way. And so this looked so much better till we take people sometimes without a jaw joint problem, and you can move their jaw and bring this back and line it up, and this doesn't bother them at all to have the jaw further forward. You don't make it, you don't grow it, but you change this angle and the condyle angle up here and make the jaw come out like that. Here's another lady. We started off and she was like this, and she really liked the feel of the teeth hitting together out here, and we got her out there pretty quick. In other words, you put this cuspid hit right down through the line right there, and it got, after a few years, you could not get her jaw back where it was. The whole thing had changed. We separated this, widened this out. This is fitting over here. She had a kind of a mouth breathing problem in there. This was 1980, looks like 86, and I don't know when the date on this, but she wore this retainer. You can see where the retainer fit up in the palate right here, and she stayed with it. And you see how much wider this is than this one over here. And this, bringing this out helped a lot. And she wore the retainer, and you could not get her jaw back where it was when we started. When I started doing this, my friend, old surgeon, said, well, you can bring them out there, but they're going to go back. Well, if you bring them out there and you hold them out there over a period of a few years, they will stay out there. But if you go back and forth all the time, they will not stay there. We've also widened this out in here, and you see where it's widened there. And when you do that, you have to bring the root of the cuspid back to do that. Here she is. That's starting and finish like here. Now here's another lady who has got the jaw back like that, and here we brought it forward, and you take the teeth look like that. She had no posterior teeth on part of the upper and the lower, so she's got upper and lower partials, and this is adult orthodontics, and this is what I'm keep pushing. And somebody asked, well, how did you save all these cases all these years? I lectured on these cases. These are just the lecture cases that I used for years. And we could take an adult case like this and do orthodontics and restorative dentistry at the same time, and you end up like that. And this is where I think dentistry ought to go to. If you have to work as a team, get you some team members. Somebody that knows how to do orthodontics, somebody knows how to do restorative dentistry, and then somebody's just got some common sense about where to put the things, then do that here. And this is a good example. She looks like that. We want it to here. She's got these partial dentures in like that. Now there's the two partials. Here this was here where she had nothing, so we opened the bite a little bit and brought the jaw out, brought this back some, and brought this forward some, and we put these together right over here. And you can look at the full case if you want to. And here again, we brought this cuspid back to right here. You see the partial dentures that she's wearing to fill this space in back here. So this is orthodontics and restorative dentistry. And I think if a good restorative man is there and he knows what he can do orthodontically, what can be done, then that should be part of the case. If you just give this case to somebody and he has no foggy idea of what he can do orthodontically, he's going to diagnose it a different way. So this is what I've pushed, and I hope that this will pass and people will learn that you've either got to have a team of people working on this, or you've got to have a restorative man that understands orthodontics and understands what it can be done that way. Either way, just so that you do the best job at diagnosing, and if you are a restorative person and you don't know orthodontics, you cannot possibly come up with some of this stuff. So I'm encouraging people to put this into dental schools, put it wherever it takes it to do it. I won't be here. I've lectured on it for years, and it had very little effect on people as far as I could tell. And there, we've got the partial denture in, and there it was. And there we brought it in and changed the appearance of that person for life, really. And here she is later on. This is 91. I don't know if this was early on here, but see the drastic difference it makes in a person's face to bring the jaw out and bring this out somewhere, well, not that far, but look at the difference it makes. And there's a world of adults that would love to change things like this and would love to do this. And why this is not taught, well, it may be taught in some orthodontic schools, but most of them, they do not teach this type of orthodontics. So I won't be around long to mess with it. Here's a young lady that worked for me for years, and she went to Atlanta. She learned orthodontics and went and worked in a pediatric clinic in Atlanta, I believe, and came back, and I've got some long-term pictures on her. And she had a crowded lower anterior, and we expanded that. We separated her palate. By the way, when she was 32 years old, she is overdoing the brushing. As you can see the roots of those teeth sticking out like that. But this is her teeth looked like that the day we saw her. She had a crossbite back here, meaning a mouth breather, and pushing the teeth down of the lower tongue in the lower part of the mouth, widen that out. We had to expand the palate. So you can look, he's age 32. People said you couldn't do that, so we put force between the centrals out here, and we were able to expand the palate up in the 30s, and I even had some people in the 40s that you could expand the palate. And I've had people that it wouldn't expand, and we just kept the pressure on there long enough, and we just stretched the bone in there. I have one case that you could look. This guy weighed 312 pounds, and he was just the nicest guy in the world. And we put this in, and he expanded the whole palate and never separated the suture as far as we could tell. And this is a 32-year-old lady. And there's the lower, and he expanded the lower anterior. And if you get the roots of this back behind the crown, you can expand these cuspids all you want to, and they will not automatically go back where they thought. And I want to stress that point. You can do that, but you got to get the angle of them and bring the root back on the cuspids. And here she is. After this is years later, she came back from Atlanta, and I got some pictures of her and her husband. And that's, I think, the end of this video. So I'm going to close it out, and I hope you'll join our little group here and subscribe to our channel, and that'll be nice. And we've got people all over the world that we hope to show orthodontics to everybody that wants to know what can be done in orthodontics. And I'm not perfect by a long shot, but we have changed some of the things. So I'm going to sign off here and hope you'll join our group. Thank you now.